Hello friends, welcome back to another episode of Ask Amanda Anything, my weekly bite-sized videos answering your questions about resumes, cover letters, and your job search strategy. So I had a question come in, or actually it's come in a couple times that I'm going to address today. And today we're going to talk about how to address school changes, basically when your plans have been uprooted in one way or another because of the COVID-19 pandemic. I know that so many of you are students, whether you're RN students or NP students, and things have been kind of tricky. You've had canceled clinicals, you've had delays in graduation, you've had hiring freezes on the other side, and once you've graduated. So today I'm going to quickly go over kind of three main things. First, I'm going to talk about what I recommend doing if you're in this situation. So what can you do to kind of make up for this time of change? Secondly, I'm going to talk about how to write about it. So basically how to feature this in your resume and cover letter. And third, I'm going to mention how you can talk about it. So how to talk about this subject if it comes up in an interview, because those have been the main questions I've been asked. What do I do when clinicals are canceled and school is disrupted? How do I write about it on my resume? And thirdly, how do I talk about it in an interview? So first, let's talk about things that you can do. Now, I'm hoping that most of you are in situations where your schools have adapted well, meaning they have kind of given you new direction and changed things a little bit, whether it's taking clinicals online or doing virtual simulations. Whatever it is, hopefully you are adapting well to that, and I definitely encourage you to do your best to go with the flow. If you have extra time on your hands, now would be a good time to consider a volunteer opportunity. I know that the more traditional volunteer programs aren't all letting people back into the hospitals yet, but there are a few organizations that are volunteer organizations specifically for COVID-19 relief. I know the National Student Response Network is one of those organizations where they're putting medical, nursing, basically health profession students to work in volunteer roles surrounding the pandemic. So that's definitely something that you can consider if you have some extra time. You can be doing some continuing ed online. So if you have extra time, now would be a great opportunity to sign up for some on-demand CME or attend a virtual conference or two. The barrier to entry is pretty low since you don't have to necessarily travel anywhere. And especially if there's a certain field that you are interested in, or a certain job that you know that you're going to be going for after the fact, you can kind of line up some professional development activities now while you're still in school to focus on those things now so that you have them and you can showcase them on the other end when you're getting ready to job search. And the other thing is that you can look into virtual clinicals. So this is probably going to be more for the NP students. There are plenty of nurse practitioners who are working in telemedicine and telehealth at this time. So what you can try to do is explore opportunities where you could be telemedicine student. So some nurse practitioners will set up a preceptorship where you are kind of virtually being precepted. So you can ask this of your current or your future or your canceled clinicals, see if they can accommodate you in a virtual way, or you can try to seek out those virtual clinicals on their own. So the next thing we want to talk about is how do we write about this in our resume? A lot of people have asked me, my clinicals have gone online, or my coursework, my things have turned into simulation labs or something. How do I put this on my resume? And I think that you can absolutely be transparent and kind of own that on your documents. So let's say you're listing out your clinical rotations and one of your rotations was canceled and they turned it into a sim lab instead, then, write the topic of that clinical, and then either in parentheses or underneath, you can say, transitioned to a simulation experience due to COVID-19 pandemic. I don't think that that's anything to be ashamed of. And I think it's important for whoever is hiring you to know where you're starting from so that they know what they need to focus on in terms of like competencies and orientation for you. And the reality is that everyone graduating in the next year or so is going to have very similar experiences where things have been canceled or changed. So I don't think that it will affect you much in the job search, but it is important to be honest about what you have done in person versus what you've done in a simulation setting. So that's just, what I recommend doing on your resume. And you can put in your profile or your cover letter if you feel like this really affected you, or you really want to mention how things changed. You can talk about how you adapted and had to do things differently during this period of time. So the third thing I want to talk about is how to talk about this in an interview setting. So a lot of people have asked me or have come to me being fearful that they're going to be asked basically what they did during the pandemic as a student. And they think that it will be perceived as a big weakness if they didn't have all of their clinicals in the traditional setting, or if there had to be some changes. And I think that this is a great opportunity to talk about how you are adaptable and how you've adapted in unforeseen circumstances, which can draw a great parallel to working as a nurse or an NP, working in a hospital or healthcare setting. Things can be unpredictable, and a really good skill to have is the ability to make changes, to assess the situation, and to make appropriate adaptations when a patient has, a patient is all of a sudden unstable, or a family member is acting out, or there's a violence situation, or there's some sort of conflict between employees, something like that. So I would, if you get asked this question, or try to have the opportunity to bring this up, because I think that it will be in your favor if you've adapted well in this time frame. You can say, things have been unpredictable this year due to the pandemic. This is what happened in my schooling. And you can say, while this isn't what I planned, or this isn't how I wanted it to go, I've been able to adapt to the new plan, and I really feel that this showcases the fact that I'm an adaptable person, and it will suit me well when I am working on the floor or working in the clinic or working, in whatever setting, because I have had this experience of having to be adaptable and change at a moment's notice, and I've done it quite well. So I think, whenever you're asked a question in an interview that you aren't super confident about, I recommend trying to acknowledge that weakness or that situation and turn it into a positive. Make sure that you're highlighting the lessons that you've learned so that they being the hiring team can see you in real time, connect those dots between being self-aware enough to know if something could be perceived as a weakness, but also acknowledging how to make lemonade out of lemons, or whatever that saying is. So hopefully that this has been helpful. So just to recap, we started talking about what to do during the pandemic if your clinicals have been canceled, or if things have gone online. You can volunteer, you can do continuing ed, you can go to conferences, you can try to get clinicals online. And then when you're writing about those things in your resume, I recommend being honest and upfront about the changes in your education as a result of the pandemic. And then when you're talking about it, use it as an opportunity to explain that you've been adaptable and bring up any lessons that you have learned from the unforeseen circumstances that will make you a better healthcare provider down the road. So I hope you have enjoyed this episode of Ask Amanda Anything, and I will see you next week.